today we are going to be finishing up lower respiratory, talking about obstructive pulmonary diseases. First, we're going to talk about bronchiectasis, which is a chronic inflammation and irreversible dilation of the bronchi and bronchioles. Some assessment findings would be a chronic cough, purulent drainage, fatigue, weight loss, anorexia, and dyspnea. Medical management, antibiotics, bronchodilators, mucolytics, humidification. Remember we talked about how you can humidify the air. A CT scan can show the dilation. Some nursing management would be the postural drainage techniques, chest percussions, and oral hygiene. Next, we're going to talk about atelectasis, which is the collapse of the alveoli. Some causes can be aspiration, mucus plugs, fluid or air, tumors, enlarged heart, an aneurysm, prolonged bed rest. Assessment findings that you're going to see is they will be cyanotic, have a fever, pain, dyspnea, increased pulse and respiratory rates, and increased secretions. Some diagnostic findings would be a chest x-ray, looking at ABGs, and monitoring the pulse oximetry results. Medical management is we want to improve ventilation. We can do this by suctioning, deep breathing, and coughing, provide bronchodilators if ordered, humidification and oxygen if needed. The best thing we can do is try to prevent atelectasis. Nursing management, deep breathing and coughing, and the use of that incentive spirometer that we talked about. Next, we're going to talk about COPD, which is chronic obstructive pulmonary disease, which is an obstruction of airflow entering and exiting the lungs. This is a group of conditions, not just one condition. This is just a group of different conditions. I'm going to post a video for y'all to watch and participate in to help you get the idea of what a patient with COPD is going through. Does anyone know someone with COPD? How does the patient appear? Watch the video and you can find out what they may be experiencing. Some common things that causes COPD would be smoking or secondhand smoke, air pollution, prolonged exposure to harsh chemicals, and some genetic factors. The two conditions that make up COPD are chronic bronchitis and emphysema. They both affect the lungs in a different way. So as you can look in the picture, here's a normal flow in normal lungs. Because these two are different, we will discuss them separately. So remember from day one, the airflow, it goes to the trachea, the bronchus, the bronchi, the bronchioles, to the alveoli. And remember, the alveoli is where that oxygen and gas exchange occurs, which helps supply oxygen to the body. First, we're going to talk about chronic bronchitis. This is the irritation or inflammation in the lining of the bronchial tubes with excess mucus. Inflammation increases the number and the size of the mucus glands. The inflammation prevents blood cells from absorbing oxygen because there isn't enough coming in. So look at our picture right there. You can see the difference from a healthy bronchiole to an inflamed with excess mucus. So look and see how much oxygen, how much room do they actually have for that oxygen to come in and out. Chronic bronchitis signs and symptoms. Chronic bronchitis can usually be recognized as a blue bloater. Blue bloater. Cyanotic and a chronic cough. Because the oxygen supply is low, the supply goes to your vital organs, which leads to a decrease in the liver and the kidneys, which is what's causing that swelling. So because the oxygen demand, the oxygen is going to your vital organs, kidneys and liver are not getting as much oxygen, which means their functioning is lowering, which means that is why you're having swelling. So with chronic bronchitis, you have that chronic bronchitis blue bloater. So a cyanotic color, a recurrent cough with increased sputum production, hypoxia, hypercapnia, respiratory acidosis. They will have an increased respiratory rate. Their increased incidence of heavy cigarette smokers. You can see right here with my blue bloater picture, they're normally smoking. They can have digital clubbing. We're going to look for cardiac enlargement, use of accessory muscles to breathe, and this usually leads to right-sided heart failure. Next, we're going to talk about emphysema. Emphysema affects the alveoli, not the bronchial tubes. The walls between the alveoli lose their elasticity. They become overinflated, which leads to retention of air in the lungs. This is why they retain the CO2. With no air, no new air, the body doesn't receive the oxygen it needs. With emphysema, the picture here, you can think of emphysema as the pink puffer. The pink puffer. The retention of air leads to CO2 retention. They can get the barreled chest. They get the barreled chest because the lungs are overinflated. Remember we talked about trapping the air. We want to encourage pursed lip breathing because it helps release the trapped air and prolongs exhalation. Remember how we do the pursed lip. You want to inhale through the nose and exhale through the lips pursed together. First, we're going to talk about some different medication treatments for COPD. Bronchodilators can be used to relax and open the air passage. Steroids help decrease inflammation. Antibiotics can be used if there are respiratory infections. Vaccines can help prevent infections that make breathing more difficult. Protein therapy is the infusion of AAT, the alpha-1 antitrypsin. Some different types of lung therapy. Your oxygen therapy, most doctors are going to say no more than 3 liters because the CO2 retention is what's driving them to breathe. So if they have too much oxygen, it will actually cause them not to breathe. Self-care. I want to encourage them to not smoke, avoid lung irritants, and participate in physical exercise. Different kind of surgeries. It's going to depend on the physician if we're going to try to remove a lung or have a lung transplant to see if it's going to help increase that oxygen supply. Next, we're going to talk about asthma. Asthma is the inflammation and bronchoconstriction of airway and hypersensitivity of the airway. There are different types, which are allergic and non-allergic. This is usually reversible, unlike COPD, which is not reversible. Some diagnostic findings. You could do chest auscultations and pulmonary function studies, which we already talked about. Assessment findings, they could be short of breath. A common lung sound would be wheezing. Usually you hear wheezing with asthmatic patients. Coughing, a production of thick sputum, prolonged expiration. If medical management is if it's an allergic, we want to avoid allergens. We can provide antihistamines, provide allergy injections, and other pharmacological management. Some nursing management would be medication administration per the MD, providing O2, teaching metered dose inhalers, and showing patients how to use the peak flow monitoring. So, asthma is a chronic inflammatory disease triggered by exposure to substances that are caused by an allergic reaction. Signs and symptoms, this is kind of more focused on children here. Signs and symptoms would be coughing, worse at night. This is because they're laying down and they're having that drainage. So this is usually worse at night. They can complain of chest tightness, pain, shortness of breath, and again, remember those wheezing breath sounds. Some treatment is to improve the size of the airway, which can be done by steroids, bronchodilators. We can suction if we notice that they're having some trouble breathing, and we want to encourage fluids because that can thin out their secretions. Some ways to prevent asthma is you want to reduce the asthma triggers. We can do this by removing carpet or vacuum weekly. This is if they are having issues to those allergens we're talking about. Mostly here we're talking about dust mites. Reduce the asthma triggers, remove carpet or vacuum weekly. Wash sheets weekly, put a dust cover on. You can humidifiers actually cause dust mites, so we want a dehumidifier if there are no other issues. I know we talked about trying to humidify the air with some respiratory disorders. With asthma, we want a dehumidifier because we don't want to encourage the dust mites. We want to make sure we're dusting weekly. Remove pets if the pet is the allergen. Never smoke around the children. Replace filters regularly. Check for mold. We want to make sure we're encouraging them to do their peak flow rate meters. This is an asthma action plan. We are talking about, when they're talking about the percentage up top, we're talking about their peak flow, what they blow normally, which so if it's between 80 and 100, their breathing is fine and there's no signs of an asthma, you're going to continue as is. If they're in the 50 to 80% of their normal breathing, so the breathing may be a little hampered, we want to use their rescue inhaler, and we're going to recheck in 20 to 30 minutes to make sure that rescue inhaler helped. If they're below 50%, the breathing is probably going to be labored or faster than normal. Breathlessness is a problem, so we want to make sure we're using our quick relief medication or nebulizer immediately, and we're going to call the doctor or 911. These are normally given to schools. This is what the doctor will fill out for students who have asthma and go to school. There's a page 176 in your HESI book, and it has a great example of an asthma action plan.